For so long, medical school has been centered around what happens in the classroom. The students, when they first come on campus, their main responsibility is learning about science, and it becomes in short order that they forget why they came to medical school and why they wanted to become a physician. With the introduction of the longitudinal tracks programs, we immerse them into the community very early in their training. And with that immersion, they get experiences with patients, they get experiences with different communities, they get experiences in kitchens. And we found that by making them eager about their general interests, it's really benefited their performance in the classroom. We have our lifestyle medicine track, where our students are really focused on health and wellness and exercise. We also have our rural health track, where our students are getting immersed into rural communities in Oregon. We also have our global and community health track, where our students will go into our local underserved communities and provide different health education and different free health clinics so that they can then practice it abroad internationally in different underserved areas. And then finally, we have the original longitudinal track that we call the Longitudinal Chronic Care Course. In short, we call it LC3. And this program is centered around pairing a student with an individual patient that is living with a chronic disease, with the goal of them gaining the patient's perspective of living with that disease, and also giving them an environment to begin communicating with patients, sharing in their individual patient's view of what type of healthcare they would like to see, and also serving as a healthcare coach to improve their overall care.
Getting to know my patient has actually been one of the best experiences from this program. I remember when we first met, just a few months after, he invited me to go see his grandchildren's birthday parties. And it was just amazing to see all of his family and see how much they appreciated the help I was giving him. And just being able to celebrate with patients at their good times and also be there for them, for example, when they're in the hospital, it means a lot, you know, being able to be there for good times and bad times with the patient.
Sharon taught me a lot, and from day one, she was a teacher. From the first day we met, she would tell me, "Do you know what spastic paralysis means?" And she had a folder with a printed Google page about it and handed it to me and said, "You should learn, because this is me." And she was like that about everything with all her diseases. But I also learned a lot about her capacity to really care about somebody, that she really welcomed me in with her diagnosis, with her family, with everything. She would say, you know, this is how you should treat a future patient of yours, or don't lose this attitude, this positivity, you need this for your future patients. She always said things like that. And whenever we would joke about something, she would say, don't lose your sense of humor. So she really dropped those lessons a lot throughout our 4 years together. And I'm gonna try my best to take them with me. A lot of what she taught also is something that could never be taught in a classroom.
This program has affected my medical education by exposing me to other things that would not be part of the curriculum. We learn a lot about nutrition and about exercise and things like that, and that's not really something that's included in most medical school curriculums. So I think it's really opened my eyes to another side of medicine.
At the San Manuel Outreach, we hosted a workshop in which we taught residents of the San Manuel community about nutrition, and we taught them easy, quick, and economical recipes for them to use at home. Native Americans have such a high incidence of diabetes. We wanted to introduce recipes which would help control their chronic disease. So we had two stations. One was the cooking station, in which participants got to actually prepare meals with the lifestyle medicine track members. And the second station consisted of my colleague and I educating them about the nutrition behind food. It just felt really good to be able to utilize the knowledge that we gained from the lifestyle track and be able to answer questions about health and nutrition that they had for us.
I think this program will affect my practice every single day. I think no matter what specialty I go into, I'm going to see lifestyle-related diseases. That's a huge part of the disease burden in America right now. And I think it'll really allow me to be able to address those preventative issues early on, and will allow me to address those diseases better than I otherwise would be able to. I definitely would recommend this program. It's been a lot of fun we get to go cook with each other and get a lot of really interesting speakers talking about smoking cessation and nutrition, and it's just been a really fun experience.
I think a large part of osteopathic care is that holistic approach to medicine, and I feel being part of this track and really trying to understand what the track is trying to give us, which is that more of an master's in public health approach to it. It's looking at the overall population and treating them as a whole. It really helps solidify the idea that care doesn't end at the hospital door or begin there. It's more than just the hospital itself, and it's really a global effort to try and improve healthcare.
If you're in the health professions and you have this responsibility to even out the playing field between you and your patient, you have to be able to find a connection that makes them comfortable, and part of that is being open to whoever walks in the door, whether they're from a different religious background or they speak a different language. Being able to adapt yourself to fit with other people is, I think, an important part of being a successful healthcare professional. And it's, I think, part of my responsibility to learn to do that as much as, learning what I'm doing in the classroom and memorizing antibiotics. We learn in our clinical medicine class, and then even beyond the clinical, there's this social, cultural, interpersonal element that I think the global health track is really feeding for me.
It's really given me insight into the rural community. As someone who wants to practice in Oregon in the future, the majority of my patients will be from a rural population, whether or not I'm in one, so it gives you good insight into the people I'll be working with in the future. We partnered up with a hospital across the street, and we get to actually work with patients and try to help lower the 30-day readmit. And so it's been really great getting to work with a patient, seeing the problems that are facing this rural community here in Lebanon.
I'm thinking about going into pediatrics. Being in the rural health track has opened my eyes to really being on a personal level and being able to get that connection with your patient. I would definitely recommend this program to future students. It's not only opened my eyes to the rural community and what it has to offer, but it's also given me opportunities as a student to be able to get in touch with the patients that are at the hospital across the street and connecting with them and seeing what problems are affecting them.
I definitely recommend this program to students in the future. There's so many opportunities, whether you want to be with patients, you want to learn from doctors, or you just want to learn about problems facing the area, so it's a great program.
I definitely think that the longitudinal tracks programs are setting a foundation for the future of medical training. The idea that everything that our students are going to need to know is learned in the classroom or from a book, that's definitely going by the wayside with the rapid turnover of medical knowledge that we have. It's amazing the amount of content that our students have to learn versus even what I had to learn 20 years ago. It's just phenomenal. So by giving them experiences to pair with the medical knowledge that they are gaining, it actually helps them with retention and gives them the ability to practice what they're learning.